So good morning, everybody, and welcome to a special edition of Security Health Plan Academy. This month, we're hosting a two-part series exclusively for our Medicare Advantage Part D members, focusing on pharmacy savings and plan benefits, in addition to our scheduled monthly webinar this Thursday. For today's session, we'll introduce you to a free service available to you that can help you save money on your medications. Who doesn't love finding a good deal? Especially when it comes to prescriptions, which can be quite costly. We're so fortunate to have Christy here, client executive from RX Savings Solutions, to provide a demonstration of the program and help you get started on your way to saving money. Christy has a passion for helping people understand the complicated world of health insurance so they can get the care they need at the best possible cost. You're welcome to type in your questions throughout the session, and I'll be sure to ask Christy once she finishes up her presentation. All right, Christy, you're welcome to go ahead and get started.
Well, thank you, Ashley, for that wonderful introduction. And I want to thank everyone who took the time to join the call today. As Ashley said, we are RX Savings Solutions, and we are a free benefit that Security Health Plan has partnered with to ensure that you get the best possible price on your medication. So as you can see on the screen here, there's two different ways that you can activate your account, and we'll talk about that in a little while. But if you were able to just grab a quick snapshot of that QR code or jot down that web link, we will walk you through how to register in just a few minutes. So here you can see a quote by someone who has worked with our amazing team to get a discount on their medication. So you can see here, this person said, we were paying about $170 per month for my wife's prescriptions. When we discovered that we had RX Savings Solutions, the total went down to $27 per month. So this is just an example of how effective we can be in really assisting you in finding a better price for the medications that you have to take every day. Today, we just want to introduce you to who we are and what we do and how we partner with your health plan. So as Ashley said, my name is Christy Denote. I work from my home in Bristol, Connecticut, and I have been really honored to work with the Security Health Plan team in administering the RX Savings Solutions for your benefits. So today we're going to go through what we are and how we can work together to really make a difference in making sure that you get the medications that you need. So I'm going to ask you all to take a minute here, and we're going to do a couple of polls. So when you think about pharmacy, which of these four words comes to mind? So A is confusing, B is time consuming, C is expensive, and D is red tape. So when you think about pharmacy, is there a particular word that comes to mind? If you could just jot it down in the chat. Give folks just a minute here. I'm sure at one point or another, you all have experienced one of these four options. I see someone wrote expensive. B, time consuming. Exactly. So, you know, there's a lot of confusion and education that really assists you in having a better experience with your pharmacy benefits. So let's go to the second poll. If you have never filled a prescription, what was the reason? And again, you have that A, too time consuming, B, sticker shock at the pharmacy counter. I know that one personally I've experienced. C, the doctor sent the prescription to the wrong pharmacy. D, an issue with a mail order. Or E, unsure about the cost. So you just decided that you weren't going to go ahead with that prescription. So I see a lot of these, sticker shock at the pharmacy counter. And that's exactly what we're here to help you with today. How to get the medications you need, again, at a more reasonable cost and something that is more affordable for you and your family. So I want to give you a little bit of history on how RX Savings Solutions came to be. So it all started with Betty. Betty is part of everything we do at RX Savings Solutions. So one day, you could see Betty walked into the pharmacy and asked which of her 8 prescription refills she skipped. Did she pay for medicine or did she pay rent? So we were founded by a pharmacist. His name is Michael Ray. And Betty came to his pharmacy counter and asked him this question. And he just had a really hard time accepting that she had to make a choice like this. He went home that night and he spent about 6 hours researching ways that he could get Betty her medications at a more reasonable cost so that she could afford all of the medications that she needed. And so he did that, and he was able to find the medications for $3,000 less per year. But what he realized from this interaction was Betty wasn't the only one that was experiencing this issue. This was a global issue within the US healthcare system, and he wanted to be able to make a difference there. So this was kind of the seed that was planted that became Rx Savings Solutions today. So what are we? We are a free service that is brought to you by Security Health Plan, and we help lower your prescription drug costs. This works with your health insurance plan, within your pharmacy preferences, and within your benefits. So we use software and we obtain information from your health plan that allows us to find, again, different options that can get you the medications that you need at a better price. And there can be various ways that we accomplish that, and I'll get into that a little bit later. But anytime that you have a potential savings opportunity, Rx Savings Solutions is going to send you a notification and make you aware of that savings opportunity. And then you can review that and either work with your doctor or our concierge team, or open what we call a contact prescriber request, which I'll show in just a moment here, to ensure that you get that change made and start to see those savings. So we make it really easy for you. Again, we bring it to your attention, and you can register, you can go on the website, we have an app, we have a concierge team, and I'll tell you all about those various methods to contact us and these savings opportunities in a minute here. But it's really a low effort on your part to make these quick and easy changes. So how does it work? We use software, and it matches your medications to options that cost less within your insurance plan. So you have an online account, and within that account, it's going to show you all of the prescriptions that you are on that have a lower cost alternative. And it also lets you compare prices. So you can actually, when you get a brand new medication, even go and research the best possible price before you even fill it the first time. So depending on your preference, we can do an email, a direct mail, or a text message to send you those notifications. And switching to a more affordable option is easy. We consult with your doctor before we make any changes, and we'll never do anything without your approval. So I see here, someone has asked if the member doesn't have an email or use a computer. And so we do have options where either you can get text messages if that's something you would like to do, or you can call our concierge team. We do direct mailing pieces to the home when there are savings opportunities as well. So there are multiple ways that you can find out about these savings opportunities and take advantage of them. So here you can see an example of the 3 different methods that we would use to contact you. So this hopefully will give you a visual of what to keep an eye out for, so that when this comes across, you're going to know exactly why you're receiving these communications. So to the left, you're going to see an example of an email. And again, you would click right on that Start Saving Now, and it's going to lead you right to where you need to go to do what you need to do and make those potential switches. If you get a text, it's going to look like this. And again, that link is going to be right within that text, making it nice and easy. And then the far right, you're going to see an example of a letter that be mailed to the home. And there will, again, be the numbers on the bottom. You can give us a call. And the other option is you could take this mailing to your doctor's appointment if you have one that's coming up, and have that discussion with him, and then he can initiate the change on his or her end. So lots of different ways to make these changes, again, very simply and easily. So our software helps us find alternatives that cost you less money, and it works the same exact way to treat the same condition. So many of us are aware that if you have a brand medication, you can switch to a generic, or maybe if you go to a specific pharmacy, there's potential if you go to a different pharmacy, you can save money. But our tool will also bring to light other switches that aren't as well known and could be more difficult to find. So we have a patented software and a team of pharmacists that help you cut through all of that red tape, find alternatives, and save money. So for example, there could be a cream version of a medication that costs less than a gel, or a tablet that could be less than a capsule, or maybe you can take 2 pills instead of 1, and that could be a savings opportunity. So all of these different options are things that our software is looking for and will bring to your attention. So to make a change, you can log into your portal. And again, we have what's called that Contact My Prescriber button. And essentially, that will kick off the entire process on our side, where we just pick up the ball and run with it from there. We'll reach out, we will make the provider aware of the switch that we think may be the right fit for you. We'll work with them, they'll call it in. The follow-up email is sent to you explaining when it's ready and when it will be completed. And then after that approval is all the way completed, we will call the new prescription in and to the retail or mail order pharmacy, and then you'll be notified when the prescription is ready. There's also an option that you can print out a letter and bring that to the doctor. So in addition to the direct mail that I showed you earlier, there is an option on the web page to print out something to take with you to the doctor. So I can show you that in a moment. Once that prescription is completed, the new drug will appear in your medicine cabinet, and you can continue to refill it without additional alerts from us. If you prefer to use your cell phone, you can see here how this looks. Very, very straightforward and easy. You will just follow the instructions on the screen, input the information from your Assurity Health Plan pharmacy card. You can enter your email, password, and then pay that money. So, really friendly. One of the really phenomenal things about our solutions is to have certified pharmacy technicians that are ready to help you. There's no phone maze. You're not waiting on hold for a long period of time. There are experts that are there to answer all of your questions. They're not going to rush you off the phone. They're allowed to take as much time as you need to ask as many questions as you need to feel comfortable with really truly understanding what we're recommending and why. And in addition to that, we have Spanish speaking support that is also available. So you can see here the phone number is available for you. Those representatives are available from Monday through Friday, 7 a.m. to 8 p.m. Central. If you prefer, there's also an email option here for you, and I can show you on the demo in just a moment here how you can write a message through the web page as well. So 3 easy ways to begin saving money. We would ask that you activate your account at myrxss.com/Security Health Medicare. You can call that 1-800 number or email, or you can and get started with those savings opportunities. So I'm going to go ahead and actually switch over to the demo. Bear with me 1 second here. So now you should be seeing what the actual website looks like. So this is the exact replica of what you will see when you log in. And you can see again, we start with Betty. She is the heart of RX Savings Solutions. So when you see a red dot like this, that is an indication that you have a savings opportunity available. So by just scrolling down, you can see, again, it has all your medications loaded in. And you can see here, right up front, there's a potential to save $11.84 per fill. So by clicking this button here, you can see the top best savings option, or if you prefer, you can see all savings options. So let's go ahead and click here. So you can see here, there's a different medication that treats the same condition. And by just clicking, you're going to see the retail option or the mail order option. And by just simply clicking on a continue button, it would initiate us reaching out to your provider for you. If for any reason that's something maybe you've tried before, didn't like the way that that medication worked, you will see all of the options that are available here. But let's say you're going to go ahead and use this first option. We have the pharmacy that you prefer preloaded into our system, so you can see that will show here. And if you just click Contact My Prescriber, that sends notification to our call center to go ahead and contact your prescriber and initiate that change. But again, if you prefer, you're able to click here, print a letter for yourself, and have that conversation with your provider by your next appointment. In addition, you'll see over to the left here, all the different pharmacies and their prices. So if there is a cheaper price than the pharmacy that you currently go to, you would be able to identify that and potentially make that switch if you prefer. When you look over at the top, you can see that you could search for medication. So again, if you got a brand new medication, you just went to your doctor today and you wanted to see the best possible cost in filling that prescription, you would put in the tablet or the dose, how many tablets you'll be receiving for the month, and then your zip code, and just hit search. And within seconds, you're going to see all of the options that are available to you. So you can see here at a retail pharmacy, it would be $30, or you would do the mail order. And again, this is all going to use your plan specific information to give you the details on the best possible cost. Anytime you want to get back to that home page, you would just click over here. One of the other really great features is our medication tab. So this is what we call our medicine cabinet. And this is going to have all of the medications that you've filled in the past 6 months. This also has a reminder capability if you wanted to set a reminder for yourself on the medication. Or if you wanted to, again, make the report to bring to your doctor's office, you could go ahead and click the button here, and it would print this all out for you. If there is a savings opportunity on these, it would show here for you as well. If at any point in time you wanted to reach out to that pharmacy support team I mentioned, you could just click the help button and that 1-800 number is going to show for you. Or if you prefer to send them a message, you could do that here as well and just click send your message, and that would go straight to the team. One of the other things I just wanted to show you was our help center here. You can, again, do your medication reminders here. You have the ability to find a pharmacy, so you can use either your address or put in a zip code if you're traveling or anything like that, and go ahead and search for a pharmacy in your area. You also have your user settings here, so if at any time you need to change your email address, put in your mobile number to get our SMS text, update your address, your physical address, or if you decide you want another primary retail pharmacy, you can change all of that right here in this section. So as you can see, I think this is a really easy to use tool. On that main page, you can see a YouTube video that again just explains a little bit more about what it is that we do if you need a refresher down the road. Lots of great information and really, really user-friendly. So let's just see one other option here. You can see with this medication, Humira, for example, it's going to show you, again, all of the various options. Sometimes we have notes from our clinical pharmacists giving you some insight into, if you're using it for a specific treatment protocol, then this is a proper suggestion for you, and you should go ahead and talk about this with your doctor, call our team, do whatever research you need to potentially feel comfortable with this switch. All of our suggestions are reviewed by a team of clinical pharmacists. So, a lot of research is done to make sure that these are really appropriate switches clinically and, going to work well for you. And again, if there's any questions, you can either talk with your doctor or our very educated pharmacy technician teams. So I'm really excited to show this to you. I hope that you all got a bit more insight into what it is that we do here at Rx Savings Solutions, and if we're reaching out to you, that we're here to help you, and we really want to save you some money on the medications that you're taking and ensure that you're able to take them and be as healthy and well as possible. So that is sort of it. I'm going to go back to the deck for just 1 second here. So now that we've gone through and you've learned a little bit more about Rx Savings Solutions, can you put in the chat what you are going to do next to engage with Rx Savings Solutions? Would you A, activate your account, B, discuss lower cost alternatives with your doctor, C, submit a contact prescriber, or D, call Rx Savings Solutions pharmacy support team? And the great thing about this poll is there are no wrong answers, all just based on the preference of how you would like to engage with us. I see Dana said A, Lauren says A. Activating your account is a great first step. That is really how you learn all of the medications that you're on currently and what savings opportunities are kind of available to you right now. And then by activating your account, even if you weren't to have a savings opportunity today, for example, you may get a new medication in a month or two, and we're going to have you activated. So we're going to send you those notifications as soon as we get that information in our system, if we see that there's something that we can do to save you money. So I'm going to go to our final slide here. Again, I wanted to share that hyperlink with you as to where you can go to activate your account. You always have the option of our call center from Monday to Friday, 7 a.m. to 8 p.m. Central, or email if you prefer. And I'm going to pause here and see if anybody has any questions. I hope you guys find this informative and as user-friendly as I believe it is, but if there's anything I can do to answer any additional questions for you, I'm happy to do that.
Well, thank you, Christy, for that very useful and informative presentation. So good to see the demo too. I mean, it seems pretty easy to use, so why not take advantage, right?
Absolutely.
We did get a few questions that I'm going to go ahead and just start by asking you, and then if we get anything in the chat, I'll be sure to ask that during the live event. But here's our first one. Can my family members take advantage of the Rx Savings Solutions savings as well?
So because it's a Medicare plan, we're only going to get information on the subscriber for claims data to be able to give savings notifications. But that being said, if there's ever a question and you wanted to call the concierge team, they're very willing to help you with any type of questions that you may have for savings.
Perfect. Another question we have is, how does Rx Savings Solutions work with my Security Health Plan pharmacy benefits?
Great question. So we get all of the claims information, and we know where you would be within the plan year for deductibles and out-of-pockets, for example. So we can recommend the savings based on where you are in your health plan year. So we have all that information behind the scenes to make sure that we're giving you the appropriate savings at the appropriate time. So we also know all of the Security Health Plan benefits and discounts. And so we incorporate all of that information into what we do when we work with you on these savings suggestions.
All right, so this is a two-part. Oh, go ahead.
I just wanted to clarify too, if that family member from question 1 is a Security Health Plan member as well, they would also have access to the solution. So thank you, Eileen, for pointing that out. And I just wanted to make sure everyone heard that as well.
Perfect. So this next question has 2 questions within the question. So I will start with the first one. It says, how long does it take between when I click contact prescriber on the portal or initiate a change and when the new prescription is updated? How will I know when it's ready, especially if it is a new pharmacy?
So typically it takes about 5 days. So we'll send the request over to the provider immediately, and then we continue to follow up. We'll follow up after 2 days, and we'll follow up after 2 more days if we need to do so. And then we watch to see if the claim comes through to ensure that it's gotten all the way over to the pharmacy and is filled. So typically around five business days.
Okay. How about we do one more question here, and that is, how is RX Savings Solutions different from a coupon or discount program for prescription drugs?
Another really great question. So we are different than those discount programs because we count towards your health plan deductibles and out-of-pockets, and we use your benefit information in what we do. So when you go for the prescription, again, that claim is going to apply to any deductibles or out-of-pockets that you may have on plan, whereas if you were to use a discount card, you would not have that benefit. So it's really, really a great tool. Again, completely free, works within your plan, and saves you money. So we really, really hope this has helped. We look forward to working with all of you and saving money together.